Hi, my name is Jessie. I'm a doctor of physical therapy. This is a quick demonstration on how you can self-traction your hip in the lateral direction at home. All you'll need is at least an 8-foot yoga belt that has a firm closure here. Some are D-rings, this one has a little bit of a buckle. It's important that that does not stretch. I do not recommend doing this exercise with a stretchy band. It should be something that is non-elastic for the safest and best effect. So you'll first want to create a loop with your belt, and then you'll open a sturdy door that has sort of your standard run-of-the-mill doorknobs, one on each side. And you'll take the belt and wrap it around the doorknob. So I'm standing facing the door and I'm wrapping around both sides of the doorknob so that I can really pull on this safely. And you definitely want it to be secured and not going to slide off of the doorknob. That's an important safety concern in this posture. Another important safety concern is how you get into the posture. So you might want to have a sturdy chair next to you to hold onto as you step your affected leg, the leg you want to treat, into the belt. So stepping into the belt and then placing the belt all the way up as high as you can comfortably at the hip crease. And I like to put hands on the hips and step legs wide apart and just lean away for maybe 4 breaths, 3 breaths, 5 here, and then come out of the traction. So my body is aligned in the same sort of plane as the door, and as I lean away, it's laterally tractioning my hip. And this feels really alleviating, especially if you have hip impingement or even low back pain. Hip pain can be relieved by this nice, simple self-traction. You can repeat this up to 10 times and go nice and slow. And again, if you need stability, have a chair close by so that you can hold on to it. You can get kind of creative, doing a side bend here, reaching one arm overhead, or even changing the direction of the traction by facing forward and leaning forward away from the door again. So the direction of pull should be, like I said, in the same plane as the door, and you can do a lot of different things here. Now, this isn't just for an injured hip. This can be preventative. It can be just supportive to do at the end of a long day's work. What I would do is, in that case, start at the hip that feels the most irritated or impacted. Go change sides and go to the less impacted hip, and then return once more to the more impacted hip. If both of your hips are the same, then you can repeat this same thing on both sides. Another version of this that I love is the downward facing dog position, Adho Mukha Svanasana. So instead of just one leg, it's both legs that we're putting into the belt, which for some of us is easier to crawl in from below, or you can step in from above, whichever feels most accessible to your body. And then you simply walk forward, lean forward, plant your feet, let the arms and the rest of the body lower the head, and then step the feet back a little bit, really using the weight against the door. And you can walk the hands forward or interlace them behind the body. And this provides equal traction for both hips at the same time. The low back is really nice. You can let the head go. It's kind of like a DIY traction table for home. To come out, you lean forward, maybe step forward, keep that same tension in the belt as you slowly rise up, and then you can unclip the belt to come out safely. So I hope this is a useful exercise for you. Be sure to consult your medical provider before performing any exercises at home, or you can always reach out to me, set up a free consult, and become a client of mine. I can coach you through this individually as needed. Be well.